because our vision at the time was to provide assistance and, importantly, also at the time, to provide some diagnosis for children with suspected fetal alcohol syndrome, because at that time a lot of children, or hardly all the children in the lower mainland, were not being tested or examined for the possibility. Memories from the beginning is the involvement of Audrey and a few mothers who were interested in getting a diagnosis for their children. I had been working with children with fetal alcohol syndrome for 20 years before I came here and met Audrey and diagnosed her son. So with the interest of other children and other people, other mothers and professional people in this area, we went to Seattle, had a look at the operations in Seattle, and decided that we could set up a program here. So with the beginning of the Asante Center, we became the first center and probably the only center in Canada at the time that we started dealing mainly with FASD.
I remember when we first opened the second location, and it was very important for, confidentiality, and especially Audrey was very in tune with making sure we're very protective of our files and that. So she found about 15 hard case briefcases so that we wouldn't be out on the sidewalk with a file where papers could fall out of it on the sidewalk. And so we had to put the file in the briefcase and go back and forth from one location to another, which was fine. And we got used to doing it, and it was normal until we started some of our neighbor offices. The people would ask us, what is going on with all the people walking up and down the sidewalk with the briefcases? And then we had to explain how between the two locations we were trying to be, very safe and protective with our files. There have been many funny things over the years. One, I recall that Dr. Asante made a big deal of making tea for everybody. And one of my first weeks when I started working at the center, it was just Dr. Asante and I. And I knew I was working in a very caring, compassionate place when it was just Dr. Asante and I, and he realized that I was working really hard, and he came over and had a cup of tea for me. And I'm not a big tea drinker, but it was one of the best cup of teas I've ever had.
When the center first opened and we were offering assessments, Audrey, she was our original founder and executive director. She insisted that we call it a center as opposed to a clinic. She did not want a clinical setting for our families. It was very important to have a comfortable and compassionate approach at our center. And this in no way did this compromise our delivery of our services, the professionalism of our clinicians. And it just made the families more comfortable, easier to do. And this approach today is still maintained at our center. It was virtually computer photocopier technology back in that day. Computer meaning very, very basic hard drives. Dr. Asante dictated to a little tape machine. I could tell you about phones and computers, devices, and all kinds of office equipment that have evolved over the year, and things that would make you say, what? The fact that at the moment our records are paperless, we would never have dreamed that back in the day.
I have noticed that funding's easier to apply for. We used to only be able to get small grants. and never operating costs were ever covered. Now I'm finding that that has changed. People are recognizing the Asante Center and the good work we do.
Our clinical services expanded from originally strictly assessments. We expanded to include speech and language assessments, CCY, autism assessments, even primary care to people that have developmental disabilities. All of that is expanded over the last 20 years. We've provided FASD diagnostic training to organizations around the world. We've created curriculum. That's only a few of the things that we do at the center. Our progression over the last 20 years has been amazing.